Hi, I'm Dr. Daniel Fleming. Thanks for your interest in breast implant surgery and for watching this video. There's two purposes to the video. Firstly, to help women who are interested in breast implants decide whether really they want to have them when they find out about the pros and the cons, the positives and the negatives. The second thing is, if you do decide you want to have breast implants, to give you information, evidence-based information to help you make the best decisions, not only to get the best result you can possibly get, but also to get the safest and the longest lasting result you can get. You know, lots of patients come to see me and they tell me the internet is really confusing. There's so many different versions of what's good and what's bad. Some sites and some surgeons might recommend textured implants and other smooth implants. Some surgeons will say go behind the muscle, some will say go in front. And it's really quite confusing, and sometimes it can be really difficult to distinguish what is really evidence-based fact from advertising hype. So having said that, how do you know this video isn't just advertising hype? Well, without wishing to boast, I do have quite a lot of experience in breast augmentation. I've been doing it for over 20 years, more than 5,500 patients. I've taught advanced techniques to plastic surgeons and cosmetic surgeons from all over the world. I act as a government expert advisor. I've published research and I've written chapters in books about breast augmentation. What I'm telling you in this video is based not only on my experience, but also on evidence. And it may be worth considering it as opposed to just relying on Dr. Google. I'm very proud of the fact that about 80% of my patients come to me through word of mouth recommendation. Whether you realise it or not, when you go to a breast implant consultation, what your surgeon is doing is developing an operative plan for you. This means working out exactly how the operation is going to go for you. Not only the size of the implant, but also the type of implant, the surface, the shape, the positioning of the implant. All of these things are going to influence your final result. And there's no best one way to do it. It depends on what you look like beforehand. And we have to tailor these things to get the best result you can get, given what you want to achieve, and again, the safest and the longest lasting result. If you go through this video and you have a good look at our website, you'll have a lot of information to help you avoid the pitfalls that many women unfortunately make when making a decision about breast augmentation. There's going to be a lot of information here, so you may feel that you want to watch the video more than once. And also, I would strongly suggest to you that you make a note of questions that you might have so that you can take that along to your consultation and make sure that all your questions are properly answered by the doctor who's seeing you for the consultation.